I'm Jonathan Colopy. I'm an executive director with the Y of San Diego County. Welcome to the Y's Be Well podcast. Today, our guest is Paige Colburn-Hargis, and our topic, fall prevention, something that we're learning about. We're going to gain resources today and understand kind of the impact that it has in community and some ideas of how we can support fall prevention. Paige is a trauma injury prevention coordinator. That's a big title with Scripps Memorial Hospital. And as I understand, also the community outreach coordinator. Paige, welcome. Nice to have you in this conversation today.
Thanks, Jonathan. It's great to be here.
I understand you are a native San Diegan. You are also, as I'm seeing, an impassioned advocate in this space and also inspired in your work more personally. And so I'd love to start there. How did you pursue a career in this area?
Well, that's a little bit of a long story, but I'll give you the mini version. About 10 years ago, my son was severely injured in a skateboard crash, resulting in a severe brain injury, a 2-month stay at Rady Children's Hospital, and really having to relearn everything.
I'm
From
sorry to hear that.
walking, et cetera. And so it really fueled my passion for this whole idea around preventable injury and how just with education, it can be a complex issue, but getting the word out there and talking to people about the importance to take preventative action, you can greatly reduce your risk. And with older adult falls, the statistics are really kind of scary about the prevalence of it and the growing nature of it. But I really like to focus on the preventable aspect, like the things that you and I can do. There's a lot of low-hanging fruit that we can really dramatically reduce our risk of joining those statistics.
So, Paige, first off, I don't mean to lightly move into this being something more personal. And so, first off, how is your son today? And also just thank you for sharing.
Oh, thank you so much. My son, he's actually the next room over. He graduated from college. He's really just a miracle. And I'm also an unabashed cheerleader for the trauma system here in San Diego. We do remarkable work. Miracles happen in our trauma center. So we really hope that we never have to see you in a trauma center. But if you do have to visit one, San Diego has a really great comprehensive system.
That is wonderful to hear. So, noting your title, Trauma Injury Prevention Coordinator, that tells me there's got to be a prevalence in this space if there is, titles in hospitals that are supporting this space. So share with me, if you will, just what is the prevalence of falls?
Oh, that's a great question. And in a trauma center, but first I should probably explain that a trauma center, most people do not know. I did not know until I interfaced with a trauma hospital. But trauma centers are usually affiliated with large hospitals. And think of it as, so you can go into an emergency room, you can go into an urgent care, but a trauma center is kind of the next step up. So long, pages and pages of requirements to be a level 1 trauma center. But one of those is having a injury prevention coordinator devoted to addressing the leading mechanisms of injury, or, the things that brought people into that center. So older adult falls, and it isn't just at Scripps La Jolla. Scripps La Jolla, they account for more than 1/3 of all trauma seen. So last year we saw over 1,800 trauma patients, 600 of which were severely injured older adults due to falls.
Wow. Wow.
So
Yeah.
and so it is the leading mechanism of injury at our center, as it is at most trauma centers as well. And then beyond that, we have motor vehicle crashes, motorcycle crashes, Scripps La Jolla e-bike crashes, and assaults and pedestrian injuries.
It was interesting, just before we came on, you shared in our conversation leading in about the incidence of leaving a hospitalization and just the great risk. And so if you would share a little bit about that.
Yeah, I there's some research that's showing, looking at Medicare and Medicaid hospital data and admission data, and what they found is, and I can't remember the exact number, but millions and millions of records were looked at over a period of time. And what they found is that in an older adult patient, so when I say older adult, I'm defining 65 plus, is considered geriatric kind of universally. And what they found is that if an older adult is hospitalized for any reason, an appendectomy, a broken wrist, whatever, that because of the things that happen while someone's in the hospital, the deconditioning, there may be some geriatric frailty. There could be other, most people, by the time you get to 65, you've got some other health conditions in there as well. And what they found is that these people were 121% higher risk of having a fall after discharge. And so this is a really big deal. So nationally, statewide, we're starting to look at the importance of kind of creating some sort of wraparound of an older adult as they get discharged. So right now, there's a lot of things going on, but there's a lot of gaps. There's a lot of obstacles to providing these type of services, but it's so important to make sure that patient, once they're discharged, if they're discharged home, right? Like if they're discharged to a skilled nursing facility, or if they're discharged with home health, I'm not including those people. I'm including people that were discharged home.
Right.
And so it's really important that those people, that there's a good look at home safety. What is their home like? Are they able to move freely about in their home? Can they take care of their basic needs? And also medication reviews, things like that. And then also connection to different community resources, physical therapy, occupational therapy. You know what I mean? Like, it can be complex, but it's important to help patients be able to secure those services. So
Well, it's
there's
interesting.
more to come on that.
Yeah, well, also just that research, now having that research, we're empowered to know that we need to provide for that transition back home. How do we get that sense of what the home environment is? Is there an outpatient worker that goes into the home to assess risks related to falls?
What has to happen typically, I'm going to talk in generalities.
Sure.
Typically, there needs to be some sort of home health that has been ordered for the patient. And that's typically the job of an occupational therapist. An occupational therapist is kind of the unsung hero in this. A lot of people don't know what an occupational therapist does, but their role is specifically helping with the activities of daily living. And so making sure to go into the home, making sure that it's safe. There aren't, there's lots of situations where, you go into people's homes and they, we all like to talk about the throw rugs, but it's deeper than that. That's one of those things, but making sure there's grab bars in the bathrooms, making sure that there's good lighting, making sure that there's easy access to get into the home and get out of the home. And that would be the job of an occupational therapist, to kind of assess those things and make recommendations on what needs to be adjusted.
And it sounds like short of that, if there isn't a referral with an occupational therapist, there could be some sort of interview part of discharge where you walk through with that client in terms of their home environment and ask those kind of questions, and also maybe provide suggestions of how they could make their home more fall preventative.
Exactly. And, you know, the county is working on, also the co-chair for the San Diego Fall Prevention Task Force. And really for, you know, one thing that I've really been advocating for is to create just kind of a hub where resources can be that people can kind of go to utilize that. So there's a document that's just waiting to be approved. So if the county can hear me, please approve this document, because, you know, as Scripps, the plan is on this discharge summary that the links to this, connections to the county services, the phone number to aging and independent services. Because if, you know, perhaps if the patient, there's a lot of obstacles sometimes to someone being able to access a link or whatever. So having a phone number to call and get that information. And then also working with first responders, same way. There's a lot of times where fire and EMS is called to do what's called a lift assist, where an older adult has, anybody has fallen, and they come into the home and help the person up, assess if they need to be transported. But if that's all they really needed, they leave. But the one really key piece of having them as a partner is they're kind of our eyes and ears. They have access to that home. So at the hospital level, we're a little blind to what's happening in the home. And what people may report or not report is, you know, we can't be assured. But a really great partner is fire, to be able to kind of identify if there are obstacles and act as a conduit to get that patient the resources they need. So hoping that this resource guide is also will be utilized by the first responders as well.
That's an excellent point. Actually, our neighbor across the street is an older individual, and they have support, in-home support, but that person isn't able to lift that individual. So there's been twice in the last 2 months that first responders have come out due to a fall. And I hadn't thought about educating them in terms of the environment and what you're talking about, empowering, supporting individuals in their home in that environment. So we talked about hospitalization. So what about the incidence? Let's kind of look at it of, you know, older adults. What is the incidence of a fall? Because we're
yeah, so according to the CDC, 1 out of every 4 adults age 65 and older will fall every
wow,
year. So,
wow.
and of those, a significant portion are not severely injured. No sort of action needs to be taken. But you know, older adult falls are also one of the leading causes of fatalities, of also, you know, injuries in that their life has changed going forward. And so really just I have 6 parents over the age of 80 myself, and I have witnessed just the whole spectrum of the things, you know, to do that, you know, as far as falls and the impact of falls. And, you know, even my grandmother was an instance of one of those older adults that did not take the preventative actions needed, did not work on physical fitness, did not work any of those things, fell, fractured her hip, and then because she became incontinent, was too embarrassed to do anything about it, became homebound, and she died within a year. So these statistics are really sad. But I have to say, because I don't want to just scare people, because having a fear of falling is a risk factor in and of itself. So the great news is most falls are preventable if taken appropriate action. And there's things that you can do that. And then also, you know, when you look at the statistics, say 25% of older adults will fall, well, then that means that 75% won't. So what can we do to keep all of your viewers in that 75 percentile, right?
Yes, I like that. It's interesting as I look at this. It was fascinating to hear about the decline that happens once someone has fallen, and how that kind of compounds itself. There's a doctor in our particular community here that is sponsoring funding related to an enhanced fitness program, which is a fall prevention program, evidence-based program, really to help combat that. so that people are empowered, core strength, stability, balance, so that they aren't as susceptible to fall. And it's interesting that fear of falling, how that can provide a restriction in your lifestyle. And if you could speak to that a little bit.
Sure. I actually teach an evidence-based program called A Matter of Balance. And this whole class is around the fear of falling. And they use a term called cognitive restructuring around just basically really kind of in a systematic way to kind of break down like what's your fear, also what's important to you, what do you really want to do, and how can we figure out as a group for you to do that safely. And it's amazing because, you know, once you start looking at things in a different way and thinking about what's possible, how could I do it, if I used an assisted device, if I used a cane, a walker, hiking poles, you know, trekking poles, would I feel more comfortable? Would I continue to do the things that I want to do? So, you know, something like going to the theater or something like that, that can be really anxiety causing. You know, there's crowds, there's rushing, there's dim lighting, there's all these kind of things. Well, okay, well, if you want to go see a play, well, how about we call ahead and we talk to the box office and we say, hey, you know, I'm bringing my mom to a play, or I'm bringing my friend and they have limited mobility. What's the best place for them to sit? You know, and I've even had instances where being surprised, like taking my mom to the theater down at the Civic Theater, and the ticket, like there was just no way. It was not safe to get her up. So I ran over to one of the ushers, explained the problem, and is there anything they can do to help us? And so they ended up putting us in some ADA seating and solved the problem. Right. And so I think part of this is just like empowering people to speak up and like think ahead, plan ahead, make the calls, make the things, and then get there early, avoid the crowds, you know. So there's different things that we can do to empower ourselves to get through those fears. And so did I answer your question fully on that?
You definitely did. I was
Okay.
just thinking about the impact on the extended family too, because when someone falls, breaks their hip, there's a decline in health, and maybe their life is more restricted or modified because of that. Just the impact in terms of, you know, how the family has to step in on a greater level. I'm also just thinking about the medical costs with that. And so just I want to walk around if we can, the economic impact, et cetera.
Sure. And as far as like for me personally, like getting caregivers involved and on the same page is really important.
Mm,
And one of the cornerstones of the Matter of Balance program is empowering people about being assertive, and kind of also, you know, breaking down there's a difference between assertive and aggressive, right? Like
mm,
we can be assertive and voice our needs, and sometimes unintentionally family always has the best interest in mind, but they don't know that kind of wrapping their parent in bubble wrap
mm,
and telling them to stay home is the worst thing they can possibly do, because
yeah.
we're going to get physically deconditioned, we're going to get weaker, which makes us more prone for a fall. And then we also know, like, one thing that Y is really great about is creating connection. So
Yeah.
when that person now stays home, they become more socially isolated. It can lead to higher rates of depression and
Mm.
things like that. And there's a cycle with that. So it's really important to get families involved with encouraging their family member to stay active in a safe manner.
I love that. So Paige, I'm going to use an analogy, and I don't know if it applies, so I'm checking this with you. I ride bikes and I help support people in learning how to cycle. And one of the things you do early on with clipping in and whatnot is you teach people how to fall. And so
Mhm.
I don't know, in this, you know, with this demographic with older adults, is that something that provides support? Is there such a thing of teaching someone how to successfully fall?
There
Ah,
are programs. There's and I think the Y is connected with them, but there's a program through the Challenge Center out in La Mesa. Um, and they have, it's called Agility, and they have a whole course where people can come. They use crash mats, they have physical
ah,
therapists, they're teaching people how to fall. I wish their services were available all over San Diego because I get that question almost on the daily.
mhm,
But here's the problem. Learning how to fall and roll into a fall and all that takes muscle memory,
mhm.
and there
Ah,
needs to be a constant practice around that. So
okay.
if I've heard examples of people that were professional football players that were able to roll out of a fall going down a flight of stairs, really remarkable things. But really the most important thing that you can do is keep your balance and gait training, keep your flexibility training. Uh, we talk about the four kind of pillars of fall prevention. So, number one is the most important is staying active. So, keeping yourself strong and flexible, and your body having the ability to kind of respond in those instances is really powerful. Um, and then also, kind of the other pillars being that, medication, having your medications reviews. There's a lot of times where there's medications can cause, you're on blood pressure medications, and it can create hypotension, or orthostatic hypotension, where you might stand up, the blood doesn't keep up with you, and the person is more at risk for a fall. There's also, they can make you dizzier. There's interactions with other drugs. So handling that medication piece with your doctor and pharmacist is really important. Having your eyes and ears checked, really important. And then really that making your home safer. Just like make sure that you've got good lighting, that you're not stepping over extension cords, that your kitchen is set up so that you're not having to bend over. Your bathroom has those things, like all of those things. Uh, for me, like, put your bets on those. And
Yeah.
I have no problem whatsoever, but I feel like there I would love to talk with the Challenge Center a little bit more about, do you get your average everyday grandma coming in and like being willing to fall onto crash mats and get up and all that? Uh
Yeah.
so I would say yes, and
And no, you highlighted some critical areas for us to attend to be successful and really prevent falls. So I greatly appreciate that. You also highlighted within this some good news, and that's when there's 1 out of 4 that are falling, there is 75% that are successfully mediating not falling. So that is great to know.
right.
Before we conclude, anything else that you want to share? It sounds like Scripps is doing some wonderful things in this space, and you highlighted some things in the community. Anything else that we should know?
I just really think the one thing that take away for me from the Matter Balance class and working with older adults in general is like working with people and basically making them the fall prevention evangelists.
Mm,
Like, so if we can train one older adult how to make their home safer, how to do a home safety checklist, how to like engage that with those friends, have those conversations with those friends. Because what I find is that a lot of, and data backs this up, is that, so we talked about 1 in 4 older adults falling every year. Well, guess what? Less than 50% tell their doctor about it,
oh, wow.
or tell their family member about it. So if we don't bring up the fact that we have fallen, we don't give the professionals and family members around us to help kind of get to the root cause of this and solve that problem. So, there's a lot of reasons why people don't want to talk about it. They're embarrassed. They
Sure.
think that their independence will be taken away. They think a lot of things that will happen. And I really try to encourage people, to kind of don't be in a fear-based mindset, be in an empowered, based mindset. Like, empower yourself to find out what you can do to prevent falls and becoming one of those statistics.
Thank you. I have one last question to you, and I ask this of all of our guests. Since this is the Why Be Well podcast, we ask each guest, if they're open to it, to share, since we're wanting to learn about living well, being well, what might be part of your practice in living well?
I would say my biggest practice, just everything, going through what I learned with my son, is the importance of having a gratitude practice.
Hmm.
I spend some and being mindful. And that's a lot of it. Like, all of us are moving around so fast that sometimes we forget to literally stop and smell the roses, right? Like, so I also talk to the people, the students in my classes, like the power of the pause.
Hmm.
Before we just start moving and multitasking and doing all these things, just take a deep breath.
Oh, thank you for that. I got a hit of that right there.
Yeah.
Paige, really a pleasure to connect with you. Thank you for the important work that you're doing. And for all of you that joined us till we gather again, please be well.